Hello there, my name is David Bolding. I'm one of the KarmaSue board members this year, and I'm here to introduce this amazing workshop that we're doing today. It's my pleasure to introduce the second part of our series, Cannabis and Companion Animals in Partnership with All Points West GSP Rescue. Part one of the series is available on the KarmaSue YouTube channel, so just let one of us know if you'd like to see that, and we'll get you the link for that. As part of KarmaSue's mission, these education workshops are free to all Colorado residents, but they can be expensive to produce. So I wouldn't be doing my job if I didn't ask that if you guys are interested in keeping these going, that we are always accepting donations for KarmaSue and then All Points West as well. All right, so today we have four amazing professionals with us. Dr. Casara Andre, not Cassandra. She is the founder of Veterinary Cannabis Education and Counseling. We have Trish Wilhelm, who is the co-founder of VetCS. She's also a certified veterinary technician and a veterinary cannabis counselor. We have Tess Warner, who is a certified pharmacy technician, certified professional dog trainer, knowledge assessed, and a veterinary cannabis counselor as well. We also have Janet Lewis, who's going to be joining us today for the Q&A session. She's the founding director and treasurer of All Points West GSP Rescue and responsible for Arizona and Colorado adoptions. Now, without any further delay, I'm going to introduce Casara. Take it away.
Well done. You did great on all of those. Hey, guys. So before I begin, can I see a show of hands of who maybe came to the first one? Just so I can get that's better than I thought. So if I retell a joke, you have to laugh again. That's part of the requirements, right? You can't tell anybody that I already told them. So we don't actually have too many slides in my section because I'm sort of relying on y'all to have some of that background information from the previous ones, but we're going to slide in a little bit more into some specific topics, which I'm very excited about today. But first, a little bit of review. So my slide changer is here in my front row. So just a little bit of an assessment so that everyone remembers kind of the state we're in right now when we're talking about cannabis. There is not currently, in my opinion, a more exciting realm of science or medicine. There are so many amazing things that are happening in this field of study, whether it be about the endocannabinoid system itself, so the system in mammals' bodies that we're working on, or what we can use the cannabis plant and the molecules it produces to affect that system. So just from all aspects, there is so much going on. Whenever we think, though, from a clinician standpoint, there are also a lot of dangers that are coming up as this industry develops. The industry itself is learning how to harvest, formulate, produce, store, sell, all these amazing innovations. But from the medical side, that means that there's a lot of things coming up that we're maybe not prepared to handle and maybe don't know how to keep our patients safe during. So we're going to talk a little bit about that today. Everyone's favorite, some of the mismatched legal policies. It's really easy for us to kind of get frustrated, like, man, I want better access, and that shouldn't be. But we also have to remember, again, this industry is changing so fast. Even just the science portion, policies take much, much longer to change. So rather than just being frustrated, I think it actually opens up a lot of opportunities for us to make positive change, to actually do some advocacy and speak up about what we want to see happen versus just letting things happen to us. Next slide. So I'll mostly review, but I do want to make sure everyone's on the same page. We'll talk first about the endocannabinoid system itself. This is a modulatory regulatory system in every vertebrate. Isn't that cool? So this huge section of what exists in our world has an endocannabinoid system inside of it. Now, we know most about a mammalian endocannabinoid system, so that's what we're going to focus on today. But what I want you to know about it is what we're finding out is that this system is really almost like a dashboard, a top-level control of all these smaller subsystems that are within that body. So if y'all can see it on my picture up here, I would actually change this to say this is the endocannabinoid system, kind of bring that down. But we've spent so many decades figuring out reproductive system, nervous system, sensory, all these different pieces. And we actually know them pretty well, but we didn't really have an understanding of what connected them, what brought them into balance across the entire animal that we were dealing with. Surprise, surprise, now we are actually beginning to get to that point. We know that the endocannabinoid system gives us this, almost like if you were at a concert and you see the sound guy in the background and how he can change all these little bitty knobs and affect what all the audience is hearing. That's almost what the ECS gives us in terms of control, which is really, really cool from a medicine standpoint. Next slide. There are so many things to know about the ECS. In fact, we usually spend 6 hours talking about this, and we're going to cram it into 30 minutes. But what I want you to know is that it is responsible for balance. It is responsible for homeostasis. It's responsible for regulation. So as we begin to look at our animal patients and say, there's a lot of stuff that's out of balance, a lot of stuff that's out of whack, whether it be that animal's immune system, pain, inflammation, and as we're going to talk about a little bit more in this presentation, behavior, maybe some anxiety, some aggression. When we look at the endocannabinoid system for answers, we're finding some really new and innovative ways to deal with some of these conditions because it is what's responsible for bringing that balance back into the systems. Although we won't go into too much detail, there are two big components that you should keep in mind. We know that the ECS is very strongly neuromodulatory, so it means that we can actually shape things in in conditions that have really bad nerve pain. We can also change things in an animal's psyche, so how they react to their environment. So again, anxiety, behavior. It just gives us this amazing handhold that we didn't used to. And then the immunomodulatory, we usually think about those in autoimmune conditions, allergies, inflammation, things like that. But there's also some really interesting research about how inflammation might be exacerbating some of the behavior conditions that we see in animals. And so while that's still a little bit speculatory, I think anyone who has ever had the flu or a rash or something that was really irritating, your tolerance for the rest of the stuff in your world goes way down. Are y'all with me on that? Does that make sense? So even though we're still not entirely sure of the minute connections, I think we have really solid science to say we can use our understanding of the ECS to modify a lot of different things in the body and approach these problems from many different directions versus one pharmaceutical approach. It just gives us a much bigger breadth of treatments to consider. Next slide. It's like you know what I'm about to say. So amazing. So again, such a top level, very superficial overview, but just as fascinating. We know quite a bit about what we call the classic endocannabinoid system. That means that we are pretty solidly sure about the receptors. We understand the molecules that bind to them within that mammal's body. But as this science progresses, there are actually a lot of other receptors, a lot of other ligands that we're not entirely sure how they fit into the bigger picture, so you'll hear two terms. We're only going to talk about the classic endocannabinoid system now, but there is so much that's happening all the time in all of these science areas. So that's basically what I'm going to say on the classic one. But what I do want you to pull out of this side is that this diagram that I showed you before of how complex systems can be integrated through the ECS, it's because we have activity across multiple receptors. So yes, the classic endocannabinoid receptors, but we also see that when we use molecules made by the cannabis plant to affect the system, we're actually affecting opioid receptors, dopamine receptors, serotonin receptors. And just to pause on this one for a quick second, on the human medicine side, as an example of how big this new mindset, this new knowledge is, we're, as humans, dealing with an opioid crisis. I don't think anybody doesn't know that. The depth or how much you're aware of that can kind of vary. But on human side, we see cannabis offer an amazing modality to change some of that addiction, deal with some of the pain that isn't being handled by opioids. So while this isn't really an area that we stress too much in animal medicine because we don't worry about addiction in animals, it's just amazing what our knowledge of the ECS and the cannabis plant itself is opening new doors across all areas of medicine. A little bit of a few definitions in the background kind of set up the other speakers. Hopefully all of you are decently familiar with this, but I want to make sure we're really clear. When I say cannabis in this presentation, I'm being very specifically vague. I'm saying anything that comes from this genus of the cannabis. Okay, and we have multiple species or subspecies beneath it. And it's an amazing argument, an amazing conversation to have with a grower, a biologist, a taxonomist, but clinically it doesn't matter too much to us. But what I want you to walk away with as pet parents is the understanding of kind of what molecules are mostly contained in these two big types of the cannabis plant or cannabis genus. So we have types of plants that are intentionally bred for resin. And Trish, can you go forward and then I'll have you come back to this one. So if you don't know what resin is, here are some of my favorite pictures because this plant is really, really cool. If you look at the buds on an actual cannabis plant and then zoom in to microscopic level, we find these amazing structures called trichomes, and those are the structures that make this sticky substance or resin that actually contains all of the molecules that we are interested in clinically. There's a lot of other uses for the rest of the plant, and we'll kind of go into that on the industry side, but when we're looking for molecules to use medicinally, and then go back, Trish, for a minute. We really love working with marijuana plants because they make a lot of those molecules we're interested in. Then we look at the fiber-bred plants, and we see that, man, compared to this with my little person in the background and my tractor in the background, these plants are really, really good at producing these very tall fiber stems. Some of the ways we're learning to use this in industry are incredible. We're making concrete out of them. We're using them for remediation of soil purposes. We can make clothing, we can make fiber, paper. Really, really cool. But it is a little bit harder to get some medicinal molecules just because lots of stalks, lots of stems, right? So that's kind of the biology piece. There's a big difference between the marijuana producing ones and the hemp producing ones. But what you kind of need to know is when you buy something off the shelf, so over the counter, drugstore, anywhere like that, you're buying it from a plant that was grown in this category because it has very little of this one particular molecule, THC. Now the plant itself makes a lot of other molecules, but most of our regulatory definitions are based on this one molecule. So the hemp-based plants have less than 0.3%, and marijuana plants, because again, they make lots of molecules, have more than. So from a policy perspective, again, that mismatch policy, it is easy to buy something that's from the hemp side over the counter, right? You can walk into any gas station and buy something that's made from the hemp side. So while we do work with this in animals and love it, I just want you to be aware that we can use both sides of it. These just tend to be a little bit stronger because, again, they have more of this one particular molecule. Is everyone okay with that? Any questions there? It's a really big pain point in the industry right now because we have a lot of marketing companies putting out some falsified information and some branding stuff, and I just want you to kind of know where that comes from. Okay, next slide. Oh, and then, so building off the fact that we have THC, okay, an important molecule, probably my favorite molecule that the cannabis plant makes. That's how our regulatory definitions are defined. But the plant itself, man, this is making so many amazing molecules. This number is actually pretty low. It's a pretty safe, like we're really certain about this, but probably even more than that. 600 biologically active substances that as clinicians, that just makes us drool because that's 600 different ways that we can now affect our patients positively. However, being scientists, we also have to recognize that we don't know that all these molecules work positively, right? We have some compounds in nature that are not good. We have cyanide, arsenic, all of these are natural compounds. So keep in mind that while we are very much finding cannabis and the endocannabinoid system so incredibly important to what we're doing medicinally, we also have to be careful. We can't just be on the bandwagon, cannabis for everybody, cannabis for every animal in the world. We actually need to assess the patient clinically, look at the case, know what molecules we're working with to be able to make a true medical decision. That was a question. Because I'll answer it. Questions, I'm so ready for them. So when we think about all these bigger, just active substances, there's a couple of big categories. These cannabinoids are the ones that have the molecules we're mostly hearing about today. THC, CBD, kind of the big media pushers, but we also have some other classes of molecules that are showing themselves to be, I don't know about almost as important, but maybe equally as important. They just work in a different way. We'll go into that in a second. And then some flavonoids that we know very, very little about. Someone gave me an analogy that I actually like quite well for this. The cannabinoids are seeming to be like the engine of a car, maybe, and the terpenes more of the steering wheel. And that's a very crude analogy, but I think it's showing itself to be decently true. So as we begin to think about how we're going to use this clinically, what patients it's going to work on, we need to then consider, does this patient need to be moved into a different state? Like, we really need to make some changes here, or are we just really trying to tweak some things? And so again, just giving you a picture of what we're doing clinically to evaluate what molecules we're actually looking to include. Okay, next slide. In order to do that in a medical context, this is something that's incredibly important for us to have. Do any of my previous listeners know what this is called? What's the name of this sort of graphic that you might see? Yes, very good. Very small, little quiet voices in case it was wrong, but yes, you're absolutely correct. This is called a certificate of analysis, or a COA, is what you'll normally hear these referred to as. If you are using any product for your own animals, giving advice to friends, neighbors, and definitely what we have to have in a clinical sense, we always have to have a COA. Now, last time we talked a little bit about the safety parameters and the freedom from pesticides, heavy metals, and all of those, and I'm not going to go into it today. Today, I'm just showing you the part of the analysis that tells me as a clinician which molecules I'm working with. Okay, and last time we also went into a little bit about the individual molecules themselves, which again, we don't have time for today. Just as a refresher, you can see that this one has a lot of a molecule called CBD, and it also has a very, very little amount of THC, but interestingly and importantly, it also has some other cannabinoids. And then this one here is the terpene profile, and you can just see how complicated this product is. Now, it doesn't mean that we don't use simple products or isolate products, but I think that it just makes common sense that if I'm working on a complicated case, I probably need more molecules to work with. Can we sort of work on that hypothesis? Because that's really what we're seeing clinically, even though we need some more research to back it up. So anytime we're assessing a case or a product, we really need this background information. Unfortunately, this doesn't come with every product. Only the better companies are providing these. So it provides us an actually easy way to say, I don't know that we want to work with that product. It might be great, it might be good, but I don't know what's in it. I can't give full, complete medical information because I don't know what I'm working with. I can help you assess the animal, but if you really want me to do some work with this, this is the thing that I need. Okay, next slide. And we are absolutely learning about how to use these clinically. Again, I wish we had so much more time to go into it. Maybe we'll do these at a different lecture, but we now know that when we're working on a neurology case, there are some of these molecules that we really, really want in the product. If we're working on seizures specifically, THC, CBD, particularly this guy, THCV, are just revealing how powerful they are in these conditions. Inflammation, we have some really good resources in here. Immune system, oncology, this, guys, is a huge area of what's going on in cannabis world right now because both the human and animal sides are just, medicine is inundated with cancer. And I think I would be hard-pressed to find anyone in the audience, myself included, who hasn't had some grief experience, whether it be the loss of an animal, the loss of a loved one, someone who's going through that currently in this category. So not to be too excited, but maybe just a little bit, we are actually figuring out how to definitively care for cancer. So this means kill those cancer cells. And then we're also learning about the other side, the palliative care. Maybe that cancer has progressed too far and we're really just looking for quality of life. What's amazing is that the cannabis plant, again, knowing the specific molecules, it is giving us an ability to access these conditions and make changes in these conditions that we really didn't have available to us before. Also beautifully, these molecules are showing themselves to interact really well with most of our other modalities. So instead of finding another pharmaceutical that we can only use instead of, like an either or scenario, we're finding that these molecules potentiate. Do y'all know what I mean when I say that? They're making more effective the other things that we're trying to do. So instead of being can't use you because I'm using this other one, we can bring all of these to bear on a particular case. Again, this one is an area that I'm really, really excited about because we are learning how to fully customize an animal's product to have the molecules that exactly fit their condition. Isn't that just our ideal of medicine across the board, to not take anything unnecessary, but actually support where we need to? This is really where the peak of science is right now. But yes, while interesting, my favorite one is what we're going to talk about today, and my behavior slide, because it's cool. The reason this is really, really tough is because there are so many things that go into behavior. It could be that animal's background. It could be that animal's housemates, other things going on in the household. It can oftentimes be the humans of the household. We don't always want to acknowledge that our emotional health, our emotional states absolutely affects our animals. We think a lot about dogs, especially. We'll talk about them today, but just as a quick example for cats, we absolutely see people say, oh, just please make my cat stop crying at night. Please make them stop yelling. I don't understand what's going on. And a lot of times when we counsel that pet parent through what's happening and get them to kind of control the emotions in that household, we see the cats just suddenly chill out and relax. So while it's outside the scope of our practice to diagnose something, an anxiety condition in humans, many times we want to say cannabis for everyone. everybody in the household. But I am being very serious there. We are learning about anxiety conditions in mammals, whether that be our companion animals or humans. And I think that cannabis opens up some really interesting things we need to discuss as a community of One Health concepts. We all hear those or see those funny pictures of, oh, you look just like your dog. Your dog looks just like you. But that's also true from an emotional context. Our animals look like us. And if we're seeing disease in them or feeling disease in ourselves, we actually need to think about how that translates across the board. Okay, next one. Again, a lot to go into here, but just using it sort of as a prop as we move forward. We're not going to talk about this side too much. Can you put my next one up, Trish, for my little circle? We're really going to focus here because while the hemp-based, so you'll remember those were the really tall, long plants, while those are maybe not as great at producing as many molecules as we want to have, these products are really easy to access. And I am very certain that it would be hard to find a pet in the United States today that hasn't somehow had CBD-based products in it. It's just really common for our pet parents to reach for these types of things. So it's convenient, though, that we actually have access to a lot of products because they come from hemp plants. We have to recognize, though, that when we use hemp-based products, we're going to find a lot more of some particular molecules, particularly CBD versus THC. And so, again, not to go too much into detail, when we think about needing or conditions that need that THC side, you'll remember my previous slide about for cancer, we had THC. For seizures, we had THC. So some of our more serious conditions, we really have to have these marijuana-based products. But when we're talking about behavior and some of the chronic conditions that we're going to go through today, we're really lucky in that most of our hemp-based products do very, very well. And then just as a reference for you, I put these kind of across the bottom. These are sort of just a sampling of products that you can find. So you can find pure THC products all the way over to pure CBD products. Fantastic. But why I put this up here is for you to recognize that even in our hemp-based products, we do still have some THC. And I think that's really great medically. But if we're not aware of that as a community or as a practitioner, then we're suddenly mixing molecules that we didn't know were there, and we can kind of run into some issues. Are there any questions about that for me? Is that too fast? I'm happy to stop and pause and go into more detail there. Excellent. Okay, next slide. These are the conditions that I find respond really, really well to hemp-based or heavier CBD products, CBD-dominant products. So any of these are ones that we really reach for a hemp product first. Just to touch on, because we're mostly going to focus on the behavior, for the chronic disease one, remember how I told you that the cannabis plant makes a lot of different molecules? When we're dealing with a condition that has been in place for a long time and maybe the body has tried to compensate over a period of time and brought in some other issues to try to fix this issue, and you kind of have this tangled medical scenario, these CBD dominant products are really lovely to reach for because we're kind of gently moving the system. It's kind of the softer side of cannabis. So I love for chronic conditions to use a hemp-based product. So just because you have a pet who has a very tangled medical history, don't be afraid about reaching for a cannabis product or getting a consultation on it, because now we actually have a huge range of products that we can work with. So chronic conditions, love, love, love hemp-based products for those. Immune disorders, whether it be hyperactive immune systems or underacting immune systems, I also really love CBD dominant products or hemp-based products, because what we're finding that this molecule is really good at is supporting the body's own systems. So when there's just something out of whack, CBD really is a wonderful one to reach for. When we dive into my favorite, the behavior side, the reason that we see the CBD molecule work so well is because it is what in the medical community is known as promiscuous. It means that it has interactions with so many other systems in the body. So it kind of encapsulates the picture that we have about the endocannabinoid system in this one molecule, that we can administer it to a case that has a lot of hard stuff going on and slowly see some of those tangles come undone without making changes too quickly. Does that make sense for everybody? Sometimes this is a little bit tough because we're just figuring this out now and we don't necessarily know the precise mechanisms or exactly how it's going to happen, but we're learning that we can interact with this body in helping it support its own homeostasis. So then as we, look at that, I already changed my slide for me, thank you. As we think about behavior conditions, why is this an area of medicine where we as clinicians really need more help? We need more tools. And I've just listed a couple of them up here for you, and I'd love to hear your feedback on it. So the first one, probably one of the most common, but it spans the range, right? We can have very anxious animals. We can have very shy animals. We can have very aggressive animals. We can have animals who just are not learning like they should. So behavior just covers the gamut of so many different things. So when pet parents come to us and say, can I use cannabis for a behavior condition? Probably is actually the really only answer we can give. There's a lot more that we need to know about what's going on in the background. And then that next one, most difficult to assess, what do y'all think about that? Does that sort of ring true to you? Can you give me some examples of why? Why would it be hard for us to clinically assess what's going on here? Thoughts for any anxious animal owners out there? Yes.
It's difficult to apply metrics to behavior.
Absolutely. And the goalpost always changes, right? So at first I just want you to stop tearing up my house when I leave for an hour. And then now I would like for you to stop just whining when I get back home. And now I'd actually really love for you to lie quietly when the house is nice and still. So for behavior conditions, it's hard to have a quantifiable what is our success piece, and then it has many layers that we're kind of working through. Excellent. Any other thoughts on difficulty to assess? I sort of alluded to it when we were talking about One Health concepts. Yes.
I find that it's most difficult to control the environment, which causes...
Fantastic. Absolutely. Because that sometimes can be the problem. It can be that the animal is having an actually very appropriate response to a very scary environment, but we as humans might not think that it's scary. I mean, the mailman, he doesn't scare me, but maybe he does scare the dog every day. So there's another piece that behavior questions really ask us to think about is from an animal's perspective. We can't assess it from our human brain. We really have to look and be willing to see with their eyes of, it might not make sense to us, but it is causing distress in their world. So I love that. Anything else? I kind of want to dig a little bit more into the environment piece because that's absolutely it. Any other pieces of the environment? What about that One Health portion? Why might these be hard to assess? Because it's maybe their person. And when you're working with a pet parent saying, what are your goals here? Well, I just want my animal to be less stressed. Well, the answer might be, well, human, you should be less stressed, but that's not what they want to hear from us. So again, it raises some really interesting management questions. I don't think we actually have answers to solve yet, but it's coming up more and more. Good. Yeah, I think that's all I want to say about there. Next one. Just pause here a little bit, and then I'm about to hand it over to Trish to talk more in detail about some of the molecules. We see so many pieces feed into behavior, and one of the ones that I want you to keep in mind as we go through the rest of this lecture is past patterns, past behaviors. So if you imagine with me for a moment an animal who's been raised in a shelter environment where there is so much noise, so much light, very different emotional states of the animals they're exposed to, suddenly taken from one place to another place, and the ride was scary. It is very appropriate for an animal to respond to that scenario of just like, nope, back off. I'm going to growl at you until you give me my space. That is not wrong. That is a keep myself alive as an animal response to the environment. What needs to change is this. We need to figure out how to just put this thought in the animal's brain of you're not in the environment that requires these actions anymore. Are y'all with me on that? That's a very different concept than just stop, right? Stop being afraid. Stop being aggressive. It's that those were appropriate responses, but you don't need them. Now they're maladaptive. And it's that sort of logic switch that when we can achieve it through training, desensitization, a lot of the things that we can use now, we're so successful. But the problem is that it often takes a long time, a lot of dedication by the human family to really encourage these different behaviors. And I think you'll all know what I mean when I say this, that especially anxious animals, they can go from 0 to 100 like that. So there's often no chance for us to say, whoa, 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 you're fine. Wait, there's nothing scary that's going to happen because they're already in this like, nope, I'm not listening. I don't have any room in my psyche to think there might be another possibility. So one of the things that I'll just keep it as cannabis in general, although we do know specific molecules that work better or worse for this. Cannabis seems to give us more time. It seems to give us more space in the reaction that instead of a little scary to like, whoa, I'm biting someone's face, it allows us to say, let's look at this situation together. Let's kind of work through it. And then it allows a trainer to come in, that pet parent family to come in and really make some positive reinforcement changes instead of just, I guess we're euthanizing the dog, right? But it goes there, right? That is absolutely something that we deal with every day. So when I think about a behavior case, there are so many facets that we have to assess. But one of the things that I'm fascinated about is the one, health piece, but then how we can use all of these molecules together to give us a handhold on the issue, actually begin to look at it in different depth, in different detail, and could we use what we're learning about animals for the benefit of the human population? So I am a veterinarian to my core, but I also have a lot of personal history with trauma, anxiety, PTSD, people that I've loved, people that I've lost. I think that it is so important for us to keep in mind that one health concept. As veterinarians, our oath is to protect animals, but it's also to protect the public through what we do with animals. Right now, again, going back to that mismatched policy, there are not good ways for us to test out these cannabis molecules on animals before we use them in people, but we're trying to use them in people. So there's this really big dissonance in the medical community of we don't yet know what we're working with. We need more resources for it, and we do need to be doing this research in animals. So as we talk about behavior the rest of today, just keep that in mind, that yes, we are talking about animals, but we can also apply this across bigger to mammals and the humans that are really suffering with some of these anxiety behavior disorders. So let's heal our animals first, because we're all here with pet hearts, right? And we have those animals. But remember that everything we learn in every single case, we can pull that into a bigger picture and really, in my opinion, heal the world, really heal our species as human, as well as our interactions with our dogs and cats. So I think that that's my last slide. Any quick questions for me? I think Trish and Tess will probably answer some of the big ones, but I want to make sure you're clear from what I was kind of talking about. Thoughts there? Everyone good? Awesome. I will hand it over to Trish.
Thanks. Well, hello. Casara asked me if I was a podium stander or a walker when I talk, and I wasn't sure. So I think I'm going to start here and see where I end up at the end. But thanks so much for having me. I will do a quick PSA if I sound like I'm out of breath while I'm talking. It's just an awesome pregnancy side effect that I have recently acquired, so I'm fine. I'm just heavy breathing a little bit, so I apologize. So my name's Trish Wilhelm. I'm a certified veterinary technician and a veterinary cannabis counselor. I'm also the co-founder and operations director for VetCS. So we are a veterinary-based CBD product company for dogs, cats, and horses. My co-founder is Dr. Chelsea Ludke, and she's an equine veterinarian that we kind of started out with getting pet parents asking us about using cannabis for their horses initially. And one of our very first questions was, especially being from Colorado, can I give an edible to my horse? Is that okay? Is that going to help with his hip pain? We had a very bad hip case once, and we just, immediately advised her, please don't do that. Like that. We don't know. That's not safe. At this time, years back, there wasn't all of this going on. We didn't have forums. We didn't have a lot of people really openly talking about it. So where we kind of started as a company was independent case studies for ourselves, kind of testing safety margins, efficacy with just a simple isolate and oil product in dogs, cats, and horses. So a lot of our background kind of started self-regulating. So we're, doing our own research and diving in that way. So I'm super excited to see all of this stuff going on and information out there for all you guys. I think it's really amazing. So I think we're good. Move forward one. Thank you. So this slide is mainly kind of my normal conversations that I have with pet parents every day. So I field most of the phone calls that we get in. So my history in using CBD therapy for anxiety, aside from our own case studies that we did independently, comes from you guys. I get a lot of information from pet parents every single day that call in, and whether it's anxiety, which we're focusing on today, but I get everything under the sun condition-wise of what they're wanting to accomplish with their pet. So a lot of what Casara just talked about that whole last section very much fits into that, gaining the entire picture from you guys and you giving us all the information that we can have to work with that, to make sure that we're kind of building you a safe and effective CBD therapy plan for your animal. And a lot of that conversation is education too. It's just like Dr. Andre said about people not realizing that kind of tipping point between those molecules and when you are having a hemp-based product, or, you know, are they not testing and it's a little bit higher in THC and we actually might be doing some more harm than good in that case. So we're really careful about coaching pet parents through the educational piece on what to look for, what are the best products that are out there as far as the profiles that you as a pet parent need to look for. So there's a lot of categories that go into that. And I think like we talked about earlier, it's kind of a 6-hour conversation that we're condensing into a few minutes here. So I'm always happy to go through that with anybody afterwards, and Casara is a great resource for that subject as well. So yeah, why we love cannabinoids. So really, our passion really is to elevate understanding of our cannabinoid therapy in companion animals and horses. Like I said before, through our case studies and then you guys giving us information back, we learn so much through customer communications. And these are just some of the categories that we work with. It's a little cut off at the bottom, sorry, but we're really focusing on anxiety today. That's kind of where they wanted to hit on. Anxiety is probably one of my favorite applications to work with, just because it is so expansive and it is a wide spectrum of is this a situational anxiety, or did you just adopt this dog that came from a shelter situation that's backing up and barking and scared all the time and wants to live in the crate for its first, few weeks that it's with you and doesn't want to have anything to do with you. So there's a wide range that we work with. Situational anxiety on there versus chronic, it's sort of that spectrum, but the situational is more for thunderstorms, fireworks, things we can almost predict or we know about our animal that are going to happen. That's one of my favorite ones to work with because it's really cool to see effects in these animals within sometimes 15 minutes at least I've seen. Some of them take up to 45 minutes to respond, but having that quick window and being able to anticipate and help them quickly, I find that really interesting that it works that fast for them. And we'll kind of go into dosing and application of that part of it later, but I just think that's really neat. And then these aggressive tendencies separation, I have had 3 or 4 night walkers, which is really interesting because I feel like it's sort of rare to see those a lot, but we get a lot of those that keep, the pet parent up at night and they're like, I can't sleep, Trish. What do I do? And so these ones are more of those chronic everyday anxieties that we have to kind of use trainers and more modalities to be able to help them, not just give them CBD and it's going to work. There's a lot of other profiles that we need to look at in order to make that helpful for them. So it's a little bit more of a process. Do I have any horse people in here? Not one? Dang. Okay, I'm a giant horse nerd, so that's me. But horses, this is phenomenal for equine anxiety. I put life at the end because horses have been known to be very, very, very scared of a leaf at times, or a bag flying in the wind. And normally that leaf doesn't scare them, but on a Thursday they decided it would. So that's kind of a great application for them, but farrier and vet visits, showing, trailering, equines have been amazing responders to CBD therapy with anxiety, and again, in that short window of about 15 minutes to 30 minutes, we see it working that quickly with them. And that all depends on application as well, and I'll talk about that in a little while. But some other things we love using it for: mobility disorders, chronic arthritis, or any acute trauma, injuries, hit by car that they're, kind of recovering from either, whatever injury that they acquired during that. Appetite stimulation, this one's really interesting because I love this because it mostly, for me personally, and what we see, comes in as a secondary benefit. So, I get a dog that was hit by a car and is using CBD therapy for inflammation, and they, have this whole other agenda that they want to use it for. And then the owner calls me back and they're like, oh, well, he's eating a lot better than he was the other day too. So it's kind of those nuances that you as the pet parent notice, and those secondary benefits are really cool to kind of see them shine through when really you're the only one that would notice them, even if they're not in the forefront of your head of, I want to help fix this or help them with this. And you're like, well, I kind of noticed this getting better, so that's really neat. So that's kind of what we see a lot of the appetite coming through at that point, one of those secondary benefits for them. Acute pain, this one more, I really like to incorporate a little more THC in with acute pain cases, and we can do that, and we can kind of use some products to be a little more modular in how we would like them to be used. But we have seen, great reductions in pain in laminitis in horses. That's mostly, or surgical pain in dogs post-operatively as well. Our GI disorders, this one actually is huge for cats. We see a lot of benefit in dogs, but we have a cat-specific product. IBD in cats has been amazing. So we see so many benefits in that I didn't think we would at first, to be honest. I thought it was going to be opposite because cats are cats and a little finicky about things, but yeah, that one's been really cool to see as well. And then on the bottom, it basically says that we have a lot of other various uses, but this just kind of gives you a picture of the range of what we're able to help them with. And when I'm having those conversations with pet parents, that's kind of one of the most common questions I get is, Trish, why does this feel like a panacea? Like, we've talked about so much, you've told me so much, why does it feel like we're helping so many different things almost at the same time? And it definitely goes back to the endocannabinoid system of what Dr. Andre was talking about, and those receptors being all over throughout the body, that's exactly the reason why we're able to, see so much benefit from so many different places. So I always thought that was one of my favorite areas to see. So we're good. I threw this up. I knew she was going to talk about it already, but I think repetition and reading these words and seeing them in person is really important, just because to make it a part of your language as you're talking, as you're researching, as you're reading online, I think it's a great foundation to have first. So if anything, I would say get used to reading about cannabis, get used to reading about the different subspecies that we have, and what they're used for, because I think when you have this foundation, it's so much easier for you as a pet parent to get out there and differentiate between these products and what's going on, because it is a very, very hard market to navigate for you guys. So like she said before, Genus Cannabis, we have the species and subspecies up there. Over 600 molecules within the plant as well that we talked about before. And then, that line between the CBD high and THC high strains that we see out there. I love that number is totally outdated. So it's not 80, it's 180 like we had before. But I think that's completely incredible that we have that many opportunities to research and find specific conditional benefits from these molecules. We talk about THC and CBD, and some of you might have heard of CBG and CBC recently. Those have been coming up a lot. But to have 180 that nobody really has touched most of those is pretty amazing, to where we can, have opportunities to have case-specific cannabinoids paired with, certain profiles that help a specific condition. So it's no longer, well, for arthritis, we use this dosing, blah, blah, blah. At one point, we will get to, well, this is the molecule that's best for this is the dosing with this molecule, and this is the best level to use it as. So it's it'll be really interesting to see how all that unfolds. So, slide. I threw this one up because we are talking about anxiety specifically. This has a lot to do with all of our other conditions too, but terpenes are the aromatic compounds that we find in plants. So if you walk through a hemp field or you walk into a grow, that specific smell, or if you're driving down I-25 or I-70, you can smell it from your car. Those are terpenes. So that's actually what you're smelling is the terpenes coming from the plants, giving them their specific character of smell. We find these everywhere. Lemons have limonene, pinene in pine trees. We use them in essential oils a lot for therapeutic benefit as well. So this is really nothing new. It's just an exciting extra part of cannabis that we have to offer as a part of formulation-wise and offering in products to help. So these two, limonene and linalool, so that yellow and that pink, it's very hard to read this wheel, so I'm not going to make you squint too much, but these two are huge on our terpene spectrum to have benefits for anxiety. So if you do read through some of those COAs that Dr. Andre threw up earlier, this is kind of the wheel showing you those different kinds that that bar graph had on earlier of what they have. So if you see a product that has a high limonene bar or a high linalool bar, those are going to be very good for anxiety purposes too, along with other things, but what we're focusing on today is much. So I think I'm done with that one, yeah. So this is kind of just a little bit about the dosing. I like talking about dosing, but I also hesitate just to give you guys concrete numbers. That's not really how it goes with cannabis use. So we have these starting points on this chart that I have to the right for specific conditions. A lot of these come from our personal independent studies as a company paired with what universities have been doing as far as CSU and Cornell and what they have as far as the research side and what they have started with in their ranges. So yes, there's numbers, but it's also very important just to realize that cannabis as a therapeutic plant is just that, it's a plant. So it really has the potential to be responsive to many different levels in any mammal. So what I take might not be what you would take, and that's just how it is. And so it's the same for animals. So these are more starting spots for us, and we kind of start with these ranges. But if we find that, you know, it's not really getting to where we want it to, or we feel like maybe we should bump that up a little bit, that's absolutely what we're going to do, and we're going to try to find that therapeutic window to where your pet responds best. So mucosal absorption, so this is kind of what I said I would talk about later as far as application goes. Getting it directly into the oral mucosa is going to be absorbed best, and there are recent studies coming out that says around mealtime or having it with like a more lipid-based carrier in there is actually going to be a little bit more beneficial for them therapeutically as well. So for the horse situation that I said earlier, we have a paste that we actually just squirt it right in their mouth, and that's why we get that 15-minute window. And with dogs, we have, it's just a plastic dropper, and you see this everywhere, but a plastic dropper that goes into their oral mucosa, and that's why we see that rapid response with them too. You can get it through ingesting treats. You can get where you want to be. It's just going to take a little bit longer. So for those instances in fireworks and thunderstorms, and we're trying to help them as quickly as we can, really getting into that oral mucosa is going to help them the best. So I think, this is the last thing that, this is really important to me, this little bottom part here about not recommending for dogs and cats younger than 1 or pregnant and lactating animals. That's mainly due to no research. We have nothing on that front, so that's not really good enough for me to go ahead and say, yeah, give that to your dog. Like we have to have reasons for using things. So we kind of stand by this rule of keeping it, you know, in 1 year and older in non-pregnant and lactating animals. So when I get that pet parent that calls me and says, I got this new puppy and he's in his crate and I think it's anxiety, but I'm not sure, but he's really, really going crazy all the time. And a lot of that is encouragement to seek a professional dog trainer and exercise and enrichment and all of those great categories that benefit them so well. So I put that in there specifically because I do get those phone calls all the time. Yeah, that's pretty much all of that one, I think. This is a very important slide. I talk with pet parents about this every single chance that I get if I'm doing a consult over the phone with them. We do know that CBD is specifically metabolized through P450 enzymes in the liver. That is an extremely high percentage of our pharmaceuticals that go through that exact same pathway. So Dr. Andre mentioned that word potentiate earlier. That's exactly what this is. So CBD, in being added into a pharmaceutical routine with an animal, has the potential to potentiate that opposite medication. So for instance, if we have a dog on gabapentin, which is a very common medication that we're on, I very cautiously let them know about this, but not that we can't completely not use CBD therapy. It's very possible to use them together. We just have to do it in a very safe way. So what we do is we start very low on the dosing spectrum, and we once again build up to where we would like to be with that custom dosing schedule, and then following up with the pet parent, making sure they're doing okay. Side effects from that happening is really that you have this gabapentin that you're giving every day. One day you decide to add in CBD therapy. You give that dose. That makes this gabapentin circulate continuously at a longer rate than it normally would. And then you're giving your gabapentin again on your normal schedule the next morning. So you're basically dosing on top of what's in there. So it's not really overdosing, but it sort of is borderline getting to that. So we're very careful about that because what we can see is ataxia. I've had some pet parents say that they have improper urination, drooling. So it's kind of those signs, obviously, that something is not going right. So in that instance, we obviously pull the CBD, analyze what they did. Did you do it correctly? Did you do what we talked about, or was it a mistake kind of situation? So we really pay attention to that. Our senior dogs on multiple medications do really, really well with CBD when we incorporate that smaller dosing schedule for them. Our non-steroidals on their own, we have been finding it's perfectly acceptable to use a normal dosing schedule with CBD therapy with them. It's not, it is reacting, but it's not doing anything harmful that we have found. So any, normal and non-steroidal anti-inflammatory, perfectly fine to keep going with them on that. But definitely make people aware of what they're on if you're working with a veterinary cannabis professional, telling them, even if it's down to supplements. I get pet parents sending me lists of, he gets this root and this salve and all this stuff, and which is great because we want to know all of those things. So it's important to let them know what you're doing every day. So, okay, I think that's it. This is my dog, Poppy. She earned a spot on the slide today because she is a bit of a basket case sometimes. So she is very much a 15-minute fast-acting application in her case. But this was after her CBD, and she actually calmly took a picture for me instead of like, you're looking at me. I'm going to flip in circles 5 times. So she's looking at me. It's so great. So she earned her spot there today. So any immediate questions before we do questions after, or everyone good? Okay, cool. I'll pass it off to Tess then.
Thank you so much, Trish. Hey everybody, my name is Tess Warner. I am a dog trainer as well as a veterinary cannabis counselor myself. I also like to say that I am a people trainer for a variety of reasons, namely because I find that it's great for me to train the dog, but if I don't train the person too, it's not going to last. It's not going to stay. So I'm here to do some fun stuff today. Did anybody want to see some pictures of cute dogs, some videos? While you're here. I'm here to talk a little bit about some of the case studies that I've worked with, where both behavior and cannabis were really important components to the overall picture. So, if you'll move forward. As Trish kind of touched on, anxiety can take a variety of forms in our canine companions. Obviously, the noise phobia and the car anxiety that are very situation specific. We also deal with a ton of separation anxiety. That's a really hard one. It's really stressful for everyone involved in the scenario, and I think there's a really strong guilt component for most pet parents. That's pretty severe at times. Generalized anxiety is another really challenging one. We talk about that as a diagnosis in humans, but I would argue that it very much is common in animals as well. It may have a genetic component, or it may be based on their personal history. Fear aggression, that's not something I'm going to dive into too much today, but I think it's important to recognize that some of what we observe as aggression can actually have its root in fear and therefore in anxiety. I also have a little chart here. Boogie, the very expressive Boston Terrier, has joined us to kind of show some of the behaviors. As a dog trainer, I'm really trying as best I can to focus on what I see, because I can't read a dog's mind. I have to work based on what they tell me and what they show me. But if I'm not listening in their language, then I don't know what it is they're trying to tell me, so I don't have any chance of understanding the motivations. So I think these are kind of the more commonly understood stress signs. Suspicious, maybe some hackles raised. Anxious, obviously fearful. Threatened and angry definitely can fall under an anxiety category of, I'm gonna get you before you get me. And then the whale eye, where you can see the whites of their eyes, that's something that in the veterinary world we see all the time because they just got to the vet clinic and they really don't want to be there. Some of the more subtle signs that I find some pet parents aren't as aware of, there can be some unexpected behaviors that are actually stress symptoms. So yawning, obviously that may be a sign that the animal is tired, but it can also be what we consider as a displacement behavior. I'm a little stressed right now, and I'm not really sure what to do, but I know yawning won't get me in trouble, so I'm gonna do that. That's a comfortable behavior. Similarly, sniffing the ground, licking their lips or their nose. Scratching is a big one. A lot of people think they have an itchy dog when they actually have a dog that's really freaked out. And then a stress release. So when a dog shakes for no apparent reason, sometimes it might be because they just kind of experienced a little bit of a stressful event and they're coming out of it. They're like, whew, that was a lot, but I'm doing a little better now. Feeling okay. Let me go ahead and move forward. So this is Molly. Molly is about 6 now. She is a corgi, and she has a lot going on in her life. Casara, if you'll go ahead and move forward. So Molly has been reactive toward other dogs since she came home with one of my best friends several years ago. She also has a ton of GI upset in stressful situations. So if she gets stressed, she has diarrhea, and everybody's pretty unhappy about that. She also has a bite history at this point in her life. So she has bitten 3 humans and her lovely sister dog, Midna. Midna is a lab, so she should be pretty easygoing, but I think having Molly in her life has been kind of challenging. So in addition to the behavioral piece, Molly has a pretty extensive medical history. At her level of anxiety, I would certainly consider that a medical problem. Because she has a bite history, we want to be really conscious of safety anytime we're dealing with this. Safety for a stranger coming into the home, safety for her sibling who has been to the ER multiple times by now, and safety for her parents, most of all. She also has a chicken allergy, kind of introduces a new thing into the mix in terms of administering a product. You want to be conscious of what you're giving to the pet. She's also torn both knee ligaments. The CCL in dog is equivalent to the ACL in humans, so we have a pain component in addition. And she also has chronic UTIs. So at the drop of a hat, if her parents go to town, she gets a UTI. And then she also gets diarrhea when they come back. So some of the treatments that we have already kind of started to work on with Molly before I stepped in as a veterinary cannabis counselor. An episiotomy is a surgery that was used to kind of help correct some of those UTIs. Did have a positive impact, but they didn't go away completely. She did have knee surgery. Her right was done in 2017 and her left was done last week. On the anxiety side, they've tried several different things. L-theanine is something that's in green tea. They tried a local hemp chew as well. Some estriol, which is a hormone, and Zilkine, all of which are anxiety treatments. Nothing really had a significant impact. They would see a little bit of change and then kind of return to where she was before. So we talked about dog body language. While these pictures are really cute, there's some stressed out dogs. So this is what they look like at home, which really should be the least stressful environment possible. Definitely have the whale eye. Molly is on one of her parents' laps here. Midna's body language very clearly says, I don't want to be here. I'm not comfortable. I'm not happy. Molly's kind of got the same thing. She's pretty hunched. There were some other photos her pet parents sent where she appeared to have no legs because she was so curled up, almost like a cat. So they came to me and said, I think it's time to look into cannabis, see if we can do something to kind of help with Molly's mental health and also with the safety of everyone at home. So our treatment plan was to use a hemp tincture. We chose one that had a fairly broad spectrum in terms of its cannabinoid molecules and also some of those really important terpenes, mainly the limonene and the linalool that Trish talked about. Because Molly has a sensitive GI system, we really wanted to make sure that we took it real slow with that dosing. So we took a full 2 weeks to get to what we call her target dose. Simultaneously, I know, because I know her parents, that Molly really likes scent work. She's a corgi, which means she's got that working brain. She wants to do things. We're here with All Points West today, so I'm sure a few of you in the audience have some experience with the working dogs. The more you can give them a job that is an appropriate job, the better they will do in this world that we expect our dogs to live in. So she and her parents had done a 6-week scent class, just introductory nose work, real basic, find the smell, show me where it is, we'll wander around together, nothing too crazy, certainly not at the competitive level, if anybody does that. And Molly loved it. She wanted to do that. When she saw the scent stuff come out, her ears went up, her tail went up, her body language got looser. And I said, let's bring that back in, because now that we have the cannabis on board, I want Molly to spend more time mentally in that place where she enjoys herself. So let's start doing that right after you dose her in the evenings. So, results, great news. Her sibling has not been to the ER in a year. Yay. So excited for that. I think her parents are excited in terms of their wallet as well. No human bites. That was a big, big thing for me. Her humans were getting bitten primarily when they were trying to separate the two dogs. So these two are very closely linked. When she plays fetch, they say her body language is more engaged. She's happier, she wants more of it. Her energy level is a little bit higher. She also, as I mentioned, just had surgery last week. And when I talked to her parents the other day, she said, you know, we noticed this time before the surgery, we had much better inflammation management. So they weren't using as many NSAIDs because her pain level was already a little bit lower. She was limping less, she was wanting to go on walks more, that type of thing. And then finally, she no longer gets GI upset when her family travels, which is also a huge relief for them when they go out of town. I mentioned that guilt component in terms of separation anxiety. I think there was a lot of that going on here too, because her family travels pretty frequently. And the most important part is what you can't measure, right? We talked about that earlier as well. I think that one of the important things in anxiety cases is really sort of tracking the things you can't measure, like moments like this. I'm really, really happy to see that this could happen without an ER trip, and then it did. So in addition to this, Molly's body language is also totally different. She's a pretty happy puppy these days. So next one is Cato and his extensive family. Cato is, we think, about 6 now, and he's had 2 homes. The first one he was in for about the first 2.5 years of his life, and then he transitioned over to a friend of mine. He is also a working brain dog. We don't really know exactly what he is, but he very much is high energy, high drive, and very intelligent. Cato has an extensive family, like I mentioned. We have his sister Shobi. We have his brother Orion, we have another brother Fox, and then we have his human family. So his house is pretty busy, to say the least. So even though this case study really kind of focuses on the dog, this one is definitely one of those complex situations that Casara mentioned. One of Cato's housemates, Fox, is a unique individual in his own right. Fox was hit by a car when he was a very young kitten. And he arrived to an emergency clinic blind and with head trauma, in addition to some physical damage. You can see his scar on his lip there. His vision did correct itself, but his behavior over his life has been a little erratic. And we don't really know why, but we know in humans that head trauma can lead to some unexpected behavioral consequences. So Fox will go back and forth between cuddly and aggressive at the drop of a hat, and sometimes when you don't really know why it happened. There's no apparent change in the environment that might be sparking that flip. Similarly, it works the other way. He'll go from aggressive back to cuddly in an instant. So our first thing to do was, hey, why don't we put Fox on some cannabis and see if that helps? So we put him on a nice full spectrum product to see if we could just level out some of those flips in behavior and bring him back into emotional homeostasis. In addition, Fox has a real interesting relationship with Cato. Fox was in the house first, and from the day Cato came home, he's been really focused on Fox, almost to the degree of like obsessive compulsive behavior. And you'll notice that wherever Fox is, Cato is there too. We actually are working on a children's book, Find Cato. But the problem is that this behavior out of a very large dog in a fairly small, busy household can be a little stress-inducing for the entire crowd. So what we did was, once Fox was on a cannabis product, we started implementing a pretty intensive training program that was really focused on giving Cato some work to do. So for any of you who do competitive scent work, that really wasn't our goal. We wanted to do nose work. We wanted to say, okay, I want you to identify the scent and show me where it is. But we weren't looking for competition by any means. It was more about learning how to work together. As I mentioned, his behavior in the house was a little stressful for everyone involved, and it sort of led to some tension that just perpetuated everything going on. It made everything worse. And so I really wanted to focus, again, on being the people trainer and getting them to work together. So I'm going to play this video. I think we have a little bit of audio, but I'm also going to be talking as we go. But this kind of shows you everything from where we started with Cato and his behavior with Fox to where we got at the end. Okay. Cato's a really smart dog. I think I mentioned that. These videos were taken over the course of about 2 months. So Cato's attention has wandered almost immediately. We think Cato has a little hurting in him. That is Fox. And you can see the other cat on the couch. Emily requests Cato's attention, but he's just not with her. He's not there, and he can't seem to pull back despite her requests. So what we're working on in terms of the training is really basic. We just want engagement. We teach what we call a touch command. So nose to hand, really nice and simple. I want you to pay attention to me and engage with me. By about the 2nd week, though, Cato is able to come back. In this one, Fox is somewhere over here, essentially. And you can see Cato start to say, oh, I can kind of do this. This is maybe even a little bit fun sometimes. Here, Fox is being a cat and very much in the middle of things. We have other cat. But Cato's actually much, much better than he was in the first video. He's engaged, and he's choosing to be engaged. Emily's not asking as frequently. He's just with her. He's still maybe exhibiting some stress symptoms. Interestingly, maybe the cat is too. I think there's a lot of communication going on between these two animals, and I can only work on what I see, unfortunately. There's Sister Shobi, who is totally a chow hound and would really like to be doing this as well, in case you couldn't tell. But Emily's tone is also starting to change. She is starting to engage with him in a new way. Her tone is not as monotone. When she first made those couple of asks to him, she wasn't quite there either, almost. Here, Fox enters on the left, and we're starting to do a little bit more of the scent work. Emily actually has a container in her hand that contains a birch scent. And so she's asking Cato to show her not just touch a hand, but touch the scent. And you can kind of see there where Cato's like, I know Fox is over there. I know he's over there, but I'm choosing to engage with you instead. Here, I think Fox is up on the couch and Shobi is off to the side as well. So what we wanted from Cato was a down with a nose touch to the container for his indicator that he had found the scent. And he's starting to get that here. Yes. Ideally, we want duration, where his nose stays there, like, yep, I know this is what you're looking for. There's Fox again on the couch. And again, his behavior is different. His body language is different. We're really seeing new stuff. He's still engaging with the container, but he's also having fun. And Fox is right there. This was huge. And I'm a dog trainer, so I get really excited about this stuff. And Shobi the chow hound. In addition, he's starting to use his nose and his brain. He's really saying, there's some other input beyond what my eyes can see here. And as things get more complicated, there's Fox. Cato is actually able to move around the room and focus on this container with birch scent. He shouldn't have had any reason to care about it 2 months ago, and identify it as what Emily is looking for and get those reinforcers. In addition, he's actually indicating in the way that we wanted him to. So obviously there's a lot that you're not seeing behind some of these little clips, slice of life type clips, but things have clearly changed for them. And eventually, they're doing scent work. So Emily is able to ask Cato to stay in one place while she goes and hides the container. He starts to look for it. And really, he's more engaged with Emily than anything else. And that was our goal, right? That was really what we were looking for. Fox is right here. Again, he's always there. But the fact that Cato, his tail is moving slowly, he's calm, but he's happy. Again, he's engaged with Emily. And he's using his nose. So while Cato's behavior outside of these sessions did not make a 180-degree turn, he's still very interested in the cat that wanders around. I think we saw a ton of progress in 3 months. It took a ton of work on Emily's part. She was a wonderful and very, very dedicated pet parent. And I really enjoyed working with her because of what we saw in the end and because we got to see that human-animal bond shift over time. If any of you are interested in some resources for the anxiety cases that you may have in your home or in your life, The Cautious Canine is a great book for generalized fear, anxiety situations that the dog's just not quite sure how to handle. And Patricia McConnell also has a specific resource for separation anxiety. In addition, again, because we are here with All Points West, I want to make you guys aware of Fetch Masters. They are a training organization here on the east side of Denver, and they actually do positive gun dog training. They're one of the only ones in the nation who do positive reinforcement gun dog training. That is a fantastic area to start with if you have a dog that is genetically built for gun work, but maybe has a little bit of uncertainty around anything, whether it's loud noises, life, separation anxiety. I think that's a really valuable resource. So I'm going to hand it back to Dave. Thank you guys very much.
Thank you.